Hello, everybody. Welcome to this DocCheck News interview on erectile dysfunction. Specifically, we would like to talk about injectable therapies in erectile dysfunction. And our expert on this topic is Mikkel Fout. He is Professor of Urology at Copenhagen University, Herluf and Gentofte Hospital, and Chairman of the Scientific Committee of the European Society of Sexual Medicine. Welcome, Mikkel Fout.
Thank you.
Mikkel, given PDE5 inhibitors are an undisputable success in erectile dysfunction therapy, why do we still have to talk about new therapies for ED?
Yeah, I think that's a great question. The PDE5 inhibitor is certainly a very difficult competitor. Already when the PDE5 inhibitors came out, there were studies done that showed that the number one desire from patients with erectile dysfunction was an actual cure. And with the treatments we have now, including PDE5 inhibitors, there is no cure. You have to keep taking the medication. So what we're really talking about is regenerative medicine and ways of regaining erectile dysfunction without continuous treatment. So that's why we're talking about it. It's kind of the holy grail in treatment of erectile dysfunction.
You're part of a discussion session at this year's European Association of Urology conference in Milano on regenerative injectables for erectile dysfunction. So this is a topic you have recently published about. What kind of therapy are we actually talking about when you talk about these rejectables? Can you summarize in a few sentences what this actually is?
Yeah, basically it's two different things. We have injections with stem cell containing aspirates. So basically stem cell therapy, where the hope is that the stem cells are going to go into the penis and regenerate the tissue, differentiate into especially smooth muscle cells. And then we have something called platelet-rich plasma, where the idea is that the platelets in the plasma of the patient himself contains a lot of growth factors. So if you inject that into the penis, then these growth factors will be released and cause regeneration of the tissue, smooth muscle, and blood vessels especially.
Okay, and this is also the difference to other injectable therapies that do exist for ED. They have been in existence for years, but this is a completely different way of working, right?
Yeah, the injectables that are in clinical practice now and are proven to work are completely different. You have to use those on demand, meaning right before you want the injection, and they basically relax the smooth muscle and the blood vessels. So that's a one-time treatment that you need to repeat. Completely different.
You mentioned about possible mechanisms already. What are the ideas how these new injectables, these regenerative therapies actually work? Could you comment a bit more in detail about what is already known and what is not known?
Well, regarding the stem cell containing aspirates, there are a lot of animal studies that show that this might cause the stem cells, when they get into the penis, they might differentiate into a smooth muscle. One of the problems in erectile dysfunction can be that the smooth muscle in the penis that expands with an erection is replaced by fibrotic tissue, which cannot expand. So basically, the idea is to have the smooth muscle back by these stem cells. So that's on one hand. It might also cause regeneration of blood vessels and nerve fibers. For the platelet-rich plasma, we only have a couple of animal studies, and they look at nerve regeneration specifically. So those are rat studies where the rats have undergone a crushing of the nerves that are responsible for inducing erections. And the idea is that these growth factors that are released, they will cause a regeneration of the crushed nerves. That would relate specifically to patients with severe diabetes or patients having undergone pelvic surgery, such as a prostatectomy. There is a hope, but there's no animal studies to back it up, but there's a hope that these platelet-rich plasma, these growth factors, also regenerate smooth muscle tissue like we hope that the stem cells do. But the proof or the studies are animal-based.
When we talk about these stem cells, now you take them from the adipose tissue of the patient himself. So this is not external stem cells, external tissue, but it's patient-derived tissue.
Well, actually, stem cells have been investigated for erectile dysfunction for more than 10 years now, and there's no consensus on this. You can get the stem cells the stem cells containing aspirates, I should say, from bone marrow or from placental tissue, from fetal tissue, from umbilical cord blood. You can get them from the adipose tissue of somebody else or from the patient himself, or the bone marrow of the patient himself. So there's really a lot of places to get the stem cells, and there's no consensus of what's best after more than 10 years of research. But I think we're moving more and more into taking the cells from the patient himself. Likely there's less risk of doing this, and it's also easier to get permission to do it.
Let's talk a little bit about numbers. What is the actual clinical evidence for this kind of therapy? Of course, there's a lot of animal data, no doubt, but what is out there clinically?
There's very little clinical evidence of these treatments so far. For the stem cells, we have about 10 clinical studies where the stem cells have been given to small numbers of men. And we've looked at the erections also in my own study. We've looked at the erections afterwards. But it's important to say that for all of these studies, the main outcome has been feasibility and safety. And there's been basically no control groups. And we know that there is a placebo effect in treatment of erectile dysfunction. So the clinical evidence in stem cells is very, very limited. For platelet-rich plasma, it's a little bit different. We don't have a lot of case series where all of the patients have gotten the platelet-rich plasma, but we have 2 randomized controlled trials that both seem to show a positive effect. And I think that we're very, very early. Overall, there are few patients included in these 2 trials. They do have some drawbacks, and what we see is an effect that's about 1/3 of the effect that we see with a PDE5 inhibitor, such as sildenafil or Viagra. So the clinical evidence is limited, and the effect is not very large in the studies we've seen so far.
Are there bigger trials on the way with a proper control group, like, for example, placebo injections that could be done in principle?
Yeah, as I said, there are a couple of trials already with placebo injections that seem to indicate that there might be a positive effect, and there are certainly more trials coming. But I think we need to acknowledge that these treatments have already also made it into clinical practice, and they're offered in many places over the world with a lot of promises given to the patients and at quite high cost for the patients. And I think that's very early, considering that we don't have the trials. So I think we're at a race right now to produce the good clinical trials and the good clinical evidence against this actually getting into clinical practice. So we really need the trials right now.
So final question, would you recommend to a patient who is desperate about his erectile dysfunction and who doesn't get along with the PDE5 inhibitors to give it a try at the time right now?
No, for me, no, not in clinical practice right now. I'd recommend to these patients to be included in a trial if they're really interested, but I think this is the time for trials, not for stem cells or platelet-rich plasma in the clinic. It's too early right now.